Hello and welcome to the Cable Live series. I am Ogechi Eke Anyawo, and on the weekends we talk about the impact of the pandemic in different sectors in Nigeria and how the virus is affecting Nigerians. The pandemic is ensuring that we change our lifestyles tremendously. It has led to a physical health crisis, but it has also distorted the way we led our lives in the past and the support for other public health issues, including breastfeeding. We know that breastfeeding helps set babies up for a good start in life and puts them in good health. But new and intending mothers are having a tough time understanding what the existence of the virus means for them and their babies, especially in terms of breastfeeding. So according to Countrymeters, about 5 million children have been born in Nigeria this year, and there's still so much uncertainty and even misinformation of the nature of the disease and what it means for breastfeeding. So we have with us here today Dr. Olufunlayo. She's a senior lecturer and honorary consultant at the College of Medicine, University of Lagos and Lagos University Teaching Hospital. She's also the chairperson of the Association of Public Health Physicians of Nigeria, Lagos State Chapter. She'll answer questions around COVID and breastfeeding and help dispel myths and misinformation surrounding breastfeeding. Dr. Olufunlayo, thank you for joining us.
Good evening. Thank you for having me. Good evening, viewers, listeners.
Yeah. So, Dr. Fumi, we just really want you to share your insight, the knowledge that you have on breastfeeding and COVID.
All right. Thank you very much for this opportunity. We've just concluded the World Breastfeeding Week, which is celebrated August 1st to 7th of every year. And that seeks to promote, optimal breastfeeding practices, because breastfeeding is a well-known evidence-based intervention for promoting the health of our babies, our infants. And as we know, our indices in Nigeria are not good at all. We contribute much more to the morbidity, the deaths and illnesses in the world from, infants, that is neonatal, under 1 and under 5 mortality than many other countries. So we are one of the countries that are lagging behind. And if we look at the Sustainable Development Goals, which can actually be linked to breastfeeding, breastfeeding is one of the ways by which we can actually help to improve our status so that we are not one of the lag behind countries. So interestingly, the Sustainable Development Goals have actually been linked to breastfeeding. And so if we achieve our breastfeeding goals, we'll actually be pushing towards the Sustainable Development Goals. Talking about COVID-19 and breastfeeding, first of all, I'd like to mention a bit about what we should do during COVID-19, because people may be asking, if a mother doesn't know whether she has COVID-19 or not, should she go ahead and breastfeed her child? Well, there's been quite a bit of research, not only from COVID, but also from other viruses that are transmitted in the same way as COVID-19 or in a similar way. And it's been shown so far from what we know. There have been several studies that have not been able to show transmission of the virus from the mother to the baby, through birth. So we've had COVID-19 positive mothers who have given birth to COVID-19 negative babies. And then when we look at the risks of not breastfeeding our babies in Nigeria, in a country such as ours, with high risks of a baby dying after birth, and you compare it to the risk of a baby getting COVID-19, the recommendation by World Health Organization is breastfeed. But what would happen is that if someone is suspected or confirmed to have COVID-19 and she has to breastfeed her baby, she will follow the regular precautions. The preventive and social measures for COVID-19, which we have been talking about day in, day out, and I'm going to say them again right now. And that is, the mother would have to use a face covering that covers her nose and her mouth. Okay. Um, if it's, we would actually prefer in this case a medical mask to make sure that a lot of the secretions are being kept in. That is, if she is confirmed to have COVID-19. And then, of course, hand hygiene would be very important. So she would need to, practice good hand hygiene, wash hands frequently in the way we said, wash them for 20 seconds with soap and running water or use a hand sanitizer. Cough etiquette, of course, and then distancing from other people. So when she's feeding her baby, once she's masked, okay, and she observes hand hygiene, the mother-baby pair should be fine. So that is what is recommended. So please, for those listening out there, if you have anyone who's pregnant or just put to bed, please advise them to give their babies breast milk. And in fact, they should breastfeed exclusively. That means no water, no fluids, no other foods for the first 6 months of life. Why do we say this? Let me just put a word in there. We say this because the breast milk itself is more than three-quarters water. It is made of largely of water. So it is nature's way of giving this child a balanced diet and all the fluids that the child needs for the first 6 months of life. So please, mommies out there breastfeeding, please don't give your baby any other fluid for the first 6 months. So that's the recommendation as far as COVID-19 is concerned. Now, should we go next to how COVID-19 may have affected the practice of breastfeeding? I think that's what you wanted me to go to next.
Exactly. I think that's an important question. How it has affected the practice of breastfeeding. What are the new challenges, that COVID-19 presents for new mothers who want to breastfeed their kids?
Okay, interestingly, because like I said, the Association of Public Health Physicians of Nigeria, Lagos chapter today held a webinar to commemorate the World Breastfeeding Week, which took place a week ago. And we actually looked quite closely at the effects of COVID-19 on breastfeeding. One of our speakers took that topic and it was very well presented. Now, before this day, there had been some work done. The presenter had actually carried out a small survey within the local government where she works and asked mothers coming to the clinic about their experiences during the COVID-19 period. And we were also able to interview select mothers from different primary, secondary, and tertiary centers around Lagos, a few handpicked. Okay, and we interviewed a few mothers and we actually we took their permission and were able to play their interviews during the webinar today. And we had a wide range of responses. So, but from the survey, the small survey that was conducted, specifically was in mainland local government in their primary healthcare facilities, it was found that probably about a third of mothers found it more difficult to breastfeed during the lockdown and the COVID-19 period in general, while about 70% said the COVID-19 actually helped. And let me just quickly give you a summary of the findings from that survey. So for those who found the lockdown to be a challenge, they complained, one, of lack of food. Some of them were not able to get food. So there was a challenge with food security in the household and maybe there wasn't enough to eat. And in Nigeria, there's this perception, especially in this part of Nigeria, that a woman who hasn't eaten well cannot breastfeed. And that is not necessarily so. But a lot of women think that. So the lack of food probably made them a little less likely to breastfeed. And of course, some of them felt tired because they weren't having enough nourishment. Some mothers also, of course, found it difficult to access health care. And how does that affect breastfeeding? If they have breastfeeding challenges or they have health challenges, then they may have not been able to have them attended to. And this may have impacted negatively on breastfeeding. One major area that was mentioned by our those we interviewed was inadequate family support. You know, the COVID-19 came on us suddenly without warning, and some people who had planned to have family members come in, either from other parts of the state or from outside the state, found that they could no longer come. So some of them lacked that physical support, which was they would otherwise have had if there was no lockdown. However, for the two-thirds who said the lockdown favored them, it was mainly around the time for breastfeeding, because many of them would actually have had to go back to work, you know, after maybe 1, 2, 3, or 4 months, because the maternity leaves, for the most part, are not as adequate as we would want them to be. And so many of them said because of the lockdown, they had the leave increased, you know, without, they had no option. They just had to stay at home. So they were able to give more attention to their babies. But of course, this was for those who had a good supportive environment ab initio. So you can see that we had varying experiences. And then another thing I would say from the mainland local government information given to us by the medical officer of health of the mainland local government today, we found out that for the targets that they were given, you know, they set targets based on the target population, and there's so many indices that they use. But for breastfeeding, exclusive breastfeeding, the targets were actually slightly better met during COVID-19 than before. So beforehand, I think they had about 65%. They met the target by about 65%, but during and after the lockdown, they've gone up to about 75%. So that's an
breastfeeding mothers.
Yes, that is for the target based on the target population that PHC is supposed to serve.
Okay.
So that could mean a number of things. It could mean that more mothers were actually exclusively breastfeeding. It could also mean that maybe more mothers came to the facility. But what I'm saying is that COVID-19 had both negative and positive effects on breastfeeding. That's what I want to conclude from the information that we got from our mothers and from those working in the local government, you know, which I've just alluded to. So it's quite an interesting finding, actually.
It is, because I mean, it's surprising that 2/3 of women actually were breastfeeding more than in the past. So that's a new one, and it's sort of it's good to hear that. But we also know that mothers still are very skeptical. I know that I spoke to a pregnant woman without she didn't know if she breastfed her child, then if her child would get COVID-19. If of many mothers, is it possible to give your child? Does the breast milk contain? Can the breast milk contain COVID, the virus?
Okay, so like I tried to say earlier, from the studies that have been done so far, and even last week, there was data presented by a professor of pediatrics at Lagos University Teaching Hospital during our own celebration. And they had actually also examined breast milk of mothers who delivered with COVID-19. I'm sure you heard that the Lagos University Teaching Hospital delivered several mothers during the lockdown period. And they did not find live active virus that could infect the baby in the milk. So from all the data from around the world that we have so far, we do not see that there is a high risk of transmission from mother to baby, either through the birth period or during breastfeeding. And this is why WHO is telling us that, or advising that we should continue breastfeeding babies. The only thing we would say is that this is based on what we know now. We know a lot, but we are hoping that there will be nothing new found. So for now, please, mothers, breastfeed your babies. If there's any suspicion of COVID-19, take all the necessary precautions, but keep breastfeeding your baby, and breastfeeding exclusively if your baby is 6 months or less.
Okay, thank you. If a mother is COVID-19 positive and has to be isolated away from her baby, so she has a baby who isn't COVID-19 positive, what do we do with that child? How do we feed that child?
It's if the mother is positive, it is unlikely that they would want to completely isolate the baby. The baby will probably have to still be cared for near the mother, and so can be taken to the mother to feed. The alternative is that the mother's milk can be expressed and given to the baby. But we keep saying that for the most part, babies and young children, even when they do have COVID-19, a large proportion of them do not have symptoms. So it's advisable to give them breast milk, because the risks of them dying from not being breastfed are higher than that of contracting COVID-19 and having severe sequelae. So,
Okay, so I want to take us back to pre-COVID. I mean, Nigeria's breastfeeding rate really was not that high anyways. It was a sort of a paltry 25% or something of that sort.
exactly,
It
24%.
wasn't exactly
Um,
yes,
29%.
24%. And I mean, compared to, for instance, Ghana, 63% exclusive breastfeeding rate. What were the challenges that women had, or new mothers had, and why was why couldn't they breastfeed their children really?
Okay, now pre-COVID for Nigeria, you know that practically almost every mother breastfeed their child at one point or the other. So we have about 98% breastfeeding initiation amongst our, mothers. The challenge is not with breastfeeding. As you know, culturally, breastfeeding is accepted all around Nigeria. There's hardly any culture that I know that does not breastfeed their babies. But the challenge is breastfeeding being exclusive. Now, until about 5 years ago, I think even the 2013 Nigerian Demographic and Health Survey showed exclusive breastfeeding rates under 6 months to be about 19%. So we're hovering between 17 and 19%. But for 2018, thankfully, we had this modest increase to 29%. So the challenges are that culturally, a lot of cultures in Nigeria, and I can speak for Lagos State in particular because I've done quite a bit of research in this regard, they don't really believe that a child gets enough fluid. So let me give you some of the reasons. One, mothers will tell you they are exclusively breastfeeding until you probe them closely. And then you'll find out that they are giving their child only breast milk and water. So they feel that they've given breast milk and that is food. But then they must give water. And then when you ask them, they say, but if an adult eats, the adult has to take water. So they believe breast milk is food. And that because they've taken food, they must also take water. So that's one thing. So another thing is, of course, people feel, oh, yes, well, I can give my child only breast milk. But then when it comes to the hot season, my child needs water. My child is going to be thirsty. Then, of course, there's the pressure from family members, especially the older population. And so we cannot really change exclusive breastfeeding rates significantly in Nigeria without involving the significant others, the husband, the mother-in-law, the community members. So we must be able to carry everybody along so that pressure will reduce and everybody will instead be putting pressure on the mother to give only breast milk. It would surprise you to know that in some cultures in Nigeria, they actually feel that if they do not give the baby water and the baby for any reason does not survive infancy, that God will ask them why they did not give that baby water. So they feel obliged culturally, morally, religiously, depending on where you look in Nigeria, to give the baby water. And these are some of the challenges with, exclusivity in our country.
In education, so more people need to be aware of what is proper breastfeeding and educated as well, so they can do the right thing in terms of exclusive breastfeeding.
Education is one thing, but for behavior change, I'm sure you know it takes just more than getting information. They have to be motivated to do the action that you are making them aware of. They have to be capable of doing it, okay? And they have to have the opportunity to do it. So many different aspects have to come together to make sure that behavior change takes place. And that is why we have to use a multi-pronged approach. So for example, let me look at the aspect of capability. For a mother to be able to exclusively breastfeed, one of the things that is needed is more friendly maternity policies. So we need longer maternity leaves. Lagos State has taken the lead in the public sector, but we need the private sector and we need other states. There are a few other states that have been able to give maternity leave of 6 months. A few have done 4 months. So we need more of that. Then we also need more friendly work environments. We can't take away from the fact that in this day and age, a lot of mothers need to work to be able to keep the family together, even where the husband is present and active because of the economic realities. So many women are hard pressed and they have to go back to work. And if they don't have creches or even just breastfeeding corners, then what do? That is when they now go and buy formula or start complementary feeds prematurely. And both of these are harmful to the child. So we need more flexible work hours. As we heard in our webinar today, by from one of our goodwill messages, really, it is an investment in the economy of a nation to invest in supporting breastfeeding. And that's why I say that increasing exclusive breastfeeding rates will actually help us to meet the sustainable development goals, and it will improve our economic development. We'll spend less money on healthcare. I mean, the amount of diarrheal disease, increasing exclusive breastfeeding rates or optimal breastfeeding practices, sorry, because there are about three that WHO defines. Increasing those rates optimally in Nigeria alone will result in at least 100,000 babies' lives saved per year and about 1,000 mothers' lives saved. And not to talk of the huge amount of naira that would be saved from unnecessary visits to the healthcare center and so on and so forth. So it's really an investment. But I think one of the things that is lacking, and we also had a segment on this in our webinar, is communication of this information, especially in advocacy. What are we saying to the policymakers? How much money are we putting in breastfeeding? How much money are we putting in maternal and child health, in preventive actions that are simple? We don't need to go to the more highfalutin things. Let's invest in the simple things that will build a basic foundation in our country. We're talking about breastfeeding, water and sanitation, preventing malaria, simple for the future. This is where we need to put our money and not on highfalutin technology that in 1 month or 1 year's time is probably not going to see the light of day. So we need to be able to speak the right language, translate this information to the language that the policymakers, the implementers, and the funders will understand. And I must say we've done a good job so far. Otherwise, we won't have moved from the 19% to about 29% where we are. And I want you to know that exclusive breastfeeding rates around Nigeria now are widely varied. Some states are doing much better than others. And these again are due to a number of factors, some of which are largely cultural. So, but we must push harder because the World Health Assembly has set a target of 50% exclusive breastfeeding for babies under 6 months. It's doable, but it needs a lot of effort if we're going to meet it as a nation. Because, like I said, different parts of the country are at different levels. Okay, so we must push. And what the government and the other implementers should do is to look and put most emphasis on the areas that are lagging behind. So we should do a spot assessment and look at those areas that are behind and make sure that we put extra effort so that they can catch up with the people who are on their way, on the way. And this is the approach that is being taken by the sustainable, I mean, in meeting the sustainable development goals. So we need to, take that same approach and bring it down to our own nation so that we won't have some states shining and then some other states lagging in the background. Now, this brings me to the point that if we don't have peace, prosperity, and the basic services in all parts of the nation, then we will have challenges. So this goes to the economy, which are not health, but very much impact on it. So you see, this is why we say public health is multi-sectoral. You can't just look at the health issues alone. You must look at the other issues that impact directly or indirectly on health. Otherwise, you just find out at the end of the day that you won't meet your targets. Hello? Seems okay. I don't seem to hear you anymore.
Dr. Fumi, I'm just wondering, like the Fed is best movement is gaining ground. And it's really to say that some women do have lactation. Hello, can you hear me?
No, I didn't hear what you said. Maybe you should just take it again. Oh, she's gone off. I think her connection wasn't too good. Okay, guess we'll just hold on a minute and let her rejoin.
She will join us shortly, ma'am.
Okay.
Yes, ma'am. I guess she's having a network challenges. Okay, she's back.
Yes. All right, great.
All right, okay. Are you with us now?
Hello, Dr. Fumi.
Hello.
Hello.
Okay, yes, I can hear you. I can hear you now.
Hello, Dr. Olufunlayo.
I
Can you
can
hear me?
hear you. I can
Yes,
hear
I
you.
am. Can you hear me?
Yes, I can. I can.
Yeah.
Very well. I can hear you now. Yes. Okay. Yeah.
Sorry, I think I'm having network problems, and that's why
Okay.
it's taking me out.
You're going off again.
But I was just going to ask the last question. Yes, I was going to ask the last question, and I was saying, how do we support women who choose
It seemed as if you were with us in the webinar today because we're touching on practically all the aspects that we discussed this morning at the APHPN World Breastfeeding Week webinar. Now, women need lactation support, and therefore skilled breastfeeding counseling has been identified as the bedrock of that skilled support or that clinical support that women need. And so we're advocating for more skilled breastfeeding counselors to be able to support women with lactation problems. And this starts from the antenatal period, of course, because there needs to be birth preparedness. They need to be ready physically and psychologically to breastfeed, because a lot of breastfeeding success actually takes place in the mind. So they have to be prepped. They have to be, given that motivation to know that they can actually do it. Because some people tell women that, oh, it's not a doable thing, it's too burdensome. So they need to be told that it can be done and given practical tips so that they can also prepare ahead for the changes that we will need to make to be able to exclusively breastfeed their babies, and then breastfeed them in continuation up till 2 years, when we recommend that babies should be fed. So that's the first thing. Then at birth, there needs to be, baby-friendly policies to ensure that mother and baby are brought together. They can practice skin to skin, and that they are made to breastfeed on demand, and that there is early initiation. So the baby should be put to breast as soon as possible after delivery. And when she's put to breast, the mother should be taught positioning, proper positioning and attachment. Because if that fails, then lactation is likely going to be a problem, because there'll be myriads of issues, problem with, engorgement, the nipple pains and all that. So proper skilled breastfeeding counseling is a sine qua non for increasing exclusive breastfeeding rates. And one of the calls we made today was that we needed to really integrate skilled breastfeeding counseling into our MNCH services. So it's not just about talking about breastfeeding and telling mothers to breastfeed, but actually providing them with the ability to do so. Remember, I talked about capability when I was talking about behavior change earlier. So these are some of the challenges that mothers, face, and this is the support that they actually need.
Thank you very much, Dr. Olufunlayo, for joining us this evening. We said 30 minutes and somehow we were able to get our 45 minutes out of you. Thank you so much for sharing so much with us today. I'm sure a lot of listeners, a lot of our viewers feel more educated about breastfeeding. Thank you very much.
Thank you very much for having me. All right then. Thank you.
And to our viewers out there, thank you for joining us this evening. We look forward to having you join us again next week at about the same time with a different guest. Thank you very much.